You're listening to CoachingCues podcast, where experts all around the world answer your most burning questions surrounding the wide topic of strength training. Every week we tackle the what, the why, and the how of one specific topic in just 15 minutes. Straight to the point, no fluff. So, without further ado, let's get straight into this week's episode.
Hey everyone, thanks for tuning in. My name is Greg Potter, and today I'm speaking about the importance of sleeping well to making progress towards your strength, power, and physique goals. And if your sleep's been poor of late, then getting better sleep can acutely enhance your performance. But perhaps more importantly, getting better sleep in the long term improves your recovery from your training and can support all aspects of your health, everything from your body composition to your brain health to how well you fight off infections. And the good news is that there are probably some simple things you can do to start sleeping better almost immediately, and I'll speak about some of those strategies today too. But before we begin, the reason I'm here is that my academic research has focused on the interactions between how we sleep, our biological rhythms, our nutrition, and our metabolic health. I've also done lots of coaching over the years, including everyone from elite strength and power athletes to people who have chronic sleep disorders. And finally, I'm the co-founder and chief science officer at resilientnutrition.com, a nutrition supplement company that recently launched what, to my knowledge, is the only nutrition product designed to help you perform at your physical and mental peak, even if you haven't slept well the previous evening. Let's get to it. And to begin, I thought that we'd focus on the effects of sleep on performance. So starting with sleep loss, Brad Eisbet from Deakin University published a systematic review of 17 studies a few years ago. And he found that while sleep deprivation or the complete absence of sleep has little effects on muscle strength during training, consecutive nights of sleep restriction, in which people have some sleep but not enough sleep, reduces force output, particularly during multi-joint exercises such as leg presses or bench presses. But with respect to getting better sleep, if you look at what happens when you take people who regularly don't get enough sleep and have them spend more time in bed and thereby get more sleep, then going by the studies done to date, this intervention has probably the largest effects on performance of any sleep intervention. And in different sports, it's been shown to have positive effects, including improved reaction times, improved mood, faster sprint times, improved accuracy in skills such as serving in tennis, better kick stroke efficiency in swimmers, and more accurate free throw and 3-point field goal percentages in basketball players. So while resistance training hasn't been studied to my knowledge, this can be a really potent intervention. And then related to this, of course, there are naps after insufficient sleep. And Michelle Lastella from Adelaide has done some interesting work on this, showing that if you look at all the studies done to date, then napping can benefit a range of different performance outcomes. And those include both physical and cognitive performance. And of course, napping gives you the opportunity to supplement your nighttime sleep, potentially without compromising your sleep quality, so it's particularly helpful when you are a bit short on sleep. And her recommendation was to nap for between 20 and 90 minutes, between about 1 p.m. and 4 p.m, but to make sure that if you do nap, to allow at least 30 minutes to reduce what's known as sleep inertia, which is the grogginess that you feel before doing exercise and training or competition. And there's also been some interesting work looking at sleep quality. Pal Jabek from Oslo Metropolitan University did some research on this last year. He took untrained healthy men and he had some of them do whole body lifting twice a week for 10 weeks and others do the same exercise but with an intervention to improve their sleep quality. And what they found was that while both groups increased their fat-free mass, so their muscle mass and so on, by a similar amount, although the sleep group did increase at about 0.4 kilos more than the exercise-only group. That wasn't significantly different. The sleep group did lose fat mass, and they lost about 1.8 kilos of fat, while the other group didn't lose a significant amount of fat, and they lost about 0.8 kilograms of fat on average. And it might well be that an intervention that more potently improves sleep has larger effects, because this particular study didn't have a dramatic effect on sleep, had a very small effect. And then moving beyond performance, of course, there are the effects of sleep on health. And one thing that's very relevant to athletes and recreational lifters is musculoskeletal health. The data on this aren't entirely clear, but going by a recent narrative review, it seems that people who get 7 hours of sleep per night or less have a higher risk of injury. And specifically, when that type of insufficient sleep sustained for 2 weeks or more, those people have about 1.7 times higher risk of injury than people who get more than 7 hours of sleep. And related to this, sleep loss does consistently increase pain. So if, for example, you have some joint pain, then not getting enough sleep is likely to exacerbate that. Then there is the endocrine system, of course, and a lot of you are probably interested in the effects of sleep on hormones such as testosterone and growth hormone. And Marie-Pierre St. Onge has done some interesting research on this, showing that regularly not getting enough sleep does modestly reduce testosterone in healthy young men. And of course, it's during sleep that your body synthesizes much of its growth hormone, which is so important to remodeling connective tissues and thereby ensuring that you adapt well to training. With respect to reproductive health, obviously if sleep affects testosterone, then there could be effects on that. And using obstructive sleep apnea as an example, and this disorder is characterized by intermittent collapse of the upper airway during sleep. Going by 10 relevant studies, men who don't have sleep apnea, so you have healthy sleep, are about 55% less likely to experience erectile dysfunction than men who have obstructive sleep apnea. So clearly, some sleep issues can dramatically affect your performance in the bedroom too. And then there is immune function. And during sleep, there's a change in your hormonal environment that supports your immune function. And it's very clear that sleep affects many different immune parameters. And when you get enough sleep, you're less likely to pick up certain infections. And also getting sufficient sleep can improve your outcomes during infections, as well as your ability to respond well to vaccinations and produce lots of antibodies. Then there are the effects of sleep on the brain. Deprive somebody of sleep and practically all of their cognitive faculties are impaired, their ability to attend during tasks, their working memory, and so on. But in the long term, different types of sleep disruption clearly associate with certain neurodegenerative disorders, such as Alzheimer's disease and Parkinson's. And then finally, you'll be familiar with the term beauty sleep, and it turns out that there probably is something to this. There's been some entertaining research by some Swedish researchers showing that people rate the faces of people who have been deprived of sleep as being less attractive than people who have had sufficient sleep. So what can you do to sleep better? Well, the first thing that I'll mention is that there are different dimensions of sleep health. So it's important to get enough sleep, but it's also, of course, important to get high quality sleep, which means falling asleep relatively quickly and sleeping efficiently during the rest of the night, not waking too frequently or for too long. But when you sleep matters too, particularly when you sleep relative to your body's clock. And the variability of your sleep is important as well. So having regular sleep-wake times can have a meaningful effect on your health and potentially performance too. But starting with the basics, you're probably very familiar with sleep hygiene and some of the fundamentals of that. I spoke about the importance of daylight in my podcast on circadian rhythms, but as a starter, I think getting at least 1 hour outdoors each day in daylight is bound to be good for your sleep. And it's best to have that relatively early in the day if you're a night owl. And if you're a morning lark, then you probably don't need to worry so much about timing of exposure. Next, there's caffeine. And again, I spoke about this a bit in my other talk, but I think limiting your intake to no more than 3 milligrams of caffeine per kilogram of body weight per day and finishing it no later than 8 hours before your target bedtime is a good starting point, but there's large variation between people and how they metabolize caffeine. Regarding nicotine, you probably don't smoke if you're listening to this, but I'll just mention it because if you smoke or consume nicotine too close to bedtime, you are likely to disrupt your sleep. But nicotine is tricky in that if you take people who are trying to stop smoking and they're going through nicotine withdrawal, then that withdrawal can temporarily disrupt their sleep. And so weaning themselves off nicotine can be a helpful strategy. Then there's alcohol. If you drink alcohol late in the day, then you are likely to fall asleep faster and you'll spend a greater proportion of the early sleep period in the deeper stage of sleep. But later in the sleep period, you're likely to wake more frequently, in part because you're more likely to wake up to pee. But also alcohol is a muscle relaxant. So if you're a snorer or if you have sleep apnea, then alcohol is bound to exacerbate those problems and also increases risk of those issues in the long term. So certainly capping your intake to no more than about 2 units of alcohol, which is about a medium glass of wine or a pint of beer per day, is a good starting point. And then with respect to nutrition, I'll just mention certain supplements that I think are especially helpful for this population. So one is tart cherry juice. Looking at all studies done on this to date, it does have a small positive effect on sleep, both in terms of duration and quality. But the interesting thing is that it can improve exercise recovery too. It can reduce muscle soreness, improve recovery of muscle strength and muscle power. And it seems to potentially have these effects in part by reducing markers of inflammation. And so if you're going to try this particular product, then I would recommend 30 milliliters of tart cherry concentrate 90 minutes before exercise, and then another 30 milliliters with your final meal of the day. And most studies have used a product named Cherry Active. I have no affiliation with that company. Then there's ashwagandha, which is a so-called adaptogen, meaning that it helps people cope with stress. Taking ashwagandha can modestly enhance sleep. And the interesting thing about ashwagandha is that it has been shown to increase gains in muscle mass and strength in response to resistance training, potentially while supporting fat loss. And the men among you will also be pleased to hear that it can also slightly boost testosterone and probably does so more consistently than other things that have been studied. When I say other things, I mean supplements. So if you want to try this, then most studies have used 600 milligrams of KSM66 ashwagandha per day. You can split that into 2 doses, but you can just take it in 1 dose, and you might want to take that with your final meal of the day. And then there's L-theanine, and I recently wrote a blog about L-theanine at resilientnutrition.com. This is an amino acid that's widely used to relieve anxiety and help cope with different types of stress. And it also seems to be weakly nootropic, so it can help improve things like attention during difficult tasks. And it can also potentially modestly improve sleep. If you want to try this, then 200 milligrams once a day with dinner is probably a good starting point. Regarding your training, the load of your training obviously matters, and with respect to resistance training in general, it's really good for sleep. So in a systematic review of 13 studies, the researchers found that regular training improved all aspects of sleep with the greatest benefit on sleep quality. And the issue, of course, is that if you train too much, you can disrupt your sleep, and this is common in overreaching and even overtraining. This hasn't been studied well in resistance training, but there's some research on athletes such as triathletes showing that increasing training loads by 30% leads to functional overreaching. Don't need to go into exactly what that is, but as a result of that increase in training load, the athletes had a drop in sleep duration, as well as sleep efficiency, so the sleep became more fragmented. But importantly, those changes in their sleep were reversed during a training taper. And then with respect to training timing, while again, the research isn't entirely clear on this, I think it makes sense to finish your training no later than 3 hours before bed. And the harder your training sessions are, the earlier you should probably finish them. So if you're doing something very light 2 hours before bed, then it's less likely to be an issue than if it's very heavy. And then obviously it's important to have a pre-bed wind down routine. And there are several factors to consider here. One is systematically reducing your exposure to light in the 2 hours or so before bed. And that can mean dimming some lights or turning certain lights off, particularly overhead lights. Keeping a to-do list, if you have a very busy schedule, can be quite transformative. Just list everything that you need to have done the next day, as well as times at which you'll do those things if necessary. And then when you go to bed, if you like, you can keep your to-do list by your bedside in case you wake up during the night and think, oh, I forgot to list that. You can just jot it down and thereby get it out of your head. And when people use this strategy during transient insomnia, they tend to fall asleep faster and sleep better. Next, if you're very concerned about certain things at the moment, you can try scheduling worry time around dinner time. And the idea here is just to set aside 15 to 20 minutes each day. Sit down, list whatever you're concerned about, as well as the smallest next thing that you can do to address that concern. And then commit to not worrying about those particular items until your worry time the following day. And that might sound like a funny strategy, but it can be really effective. Another helpful tip is to have a hot shower or bath 1 to 2 hours before bed. It should probably be 10 to 20 minutes long. When people do this, they fall asleep faster, they tend to sleep slightly more efficiently, and they also sleep a little bit longer. And the reason has to do with the fact that by raising your skin temperature, you actually accelerate heat loss from your core and particularly from your brain, and that can improve your sleep. And then obviously there is your smartphone, and smartphone use has increased during the COVID-19 pandemic and can be problematic. If you take young people who have problematic smartphone use and you have them turn their phones off at least 30 minutes before bed and keep them off until the next day, they fall asleep faster, their sleep quality improves, they sleep longer, and as a result of those changes in their sleep, the next day their waking performance is better too. So for example, their working memory improves. Another strategy related to what I said at the start is to extend your sleep if your sleep quality is good but you're currently not getting enough sleep. The recommendation at the moment is that 18 to 64-year-old adults should get 7 to 9 hours of sleep per night. So if you're getting less actual sleep per night than that, you might not be getting enough. So while you only want to go to bed when you're actually sleepy, if you go through a phase in which you extend your time in bed by sleeping in a bit in the morning and perhaps reducing your caffeine intake and use of other stimulants during this time, then you can probably experience some of the benefits that I mentioned at the start. And then if your sleep quality is poor and you're spending lots of time in bed awake, then I suggest that you apply something known as stimulus control of behaviour. And the idea here is just that certain stimuli predictably lead us to engage in specific behaviours. For example, as you approach a red light, which is the stimulus, you'll tend to brake, which is the behaviour. And the reason is that our brains are so good at creating associations, but the issue is that sometimes these can be maladaptive. And in insomnia, what happens is that people associate the bed, the stimulus, with being awake, the behaviour. So you need to retrain your brain to link your bed with somewhere that you're asleep. And that means, first, only go to bed when you're actually sleepy. Second, save your bed for sex and sleep only, so no lying in bed watching TV or working from your bed or anything like that. Next, if you've been in bed for 15 minutes or so and you haven't fallen asleep, either at the start of the night or in the middle of the night when you wake up, then get out of bed, go to a different room and do something relaxing in dim lighting, and then only return to bed when you're actually sleepy. And then finally, it can be helpful to set an alarm clock in the morning during this type of sleep problem, because it will help reinforce regularity in your sleep schedule, and also it will make sure that during the day you build lots of hunger for sleep, and that pressure to sleep will lead you to fall asleep fast to the subsequent evening and can help you sleep through the night as well. And then finally, I'll mention sleep apnea, because some of you will probably be quite large people and that can predispose you to this problem. It's also very much underdiagnosed, and symptoms include things like snoring, gasping awake at night. If you have a bed partner, then if they've seen you stop breathing, that can certainly indicate you have this disorder. But then other factors such as daytime sleepiness or waking up with a dry mouth, struggling to concentrate at work, can all indicate that this is an issue. And there's a website, StopBang, STOPBANG.ca, that has a screening tool that you can check out to identify whether you might have this disorder. And then finally, your mattress is the most important item of furniture that you own. And the optimal mattress depends on you as an individual and things like your body weight. So the heavier that you are, the firmer the mattress you'll tend to need. And I think that spring mattresses or hybrid mattresses that are sprung are probably the best options for most people, because they're better at dissipating heat than foam mattresses, which tend to store heat. And if you get too hot, you won't sleep well at night. And then with respect to your pillows, you want pillows that help you keep a neutral spine. So for example, if you sleep on your back, then you'll probably need a smaller pillow than if you sleep on your side. So that was a whistle-stop tour through some of the research on the importance of sleep, as well as how you can sleep better. And there's a huge array of different sleep disorders. So please remember that I've just touched on a few issues in this podcast, but I want to leave you with one thought, and that's that healthy sleep can be a huge performance enhancer in the long term. And I really like something that a man named Michael Grander, who's a researcher in the States, said recently. He said that people need to stop seeing sleep as a cost, so thinking about how much sleep I can afford at the end of the day, and instead start seeing sleep as an investment in tomorrow. So with that, I'll say that to find out more information about sleep, do check out my Instagram page at Potter Ph.D. And also, if you're interested in things like how your nutrition affects your sleep, then do stop by resilientnutrition.com. Thanks very much, and I hope this was helpful.
Thank you for listening to CoachingCues podcast. If you would like your question to be answered by an expert, please head to coachingcues.org/ask. See you next week.